Hello and welcome to Microbiology. You are the visually gifted, and today we are talking about Corynebacterium Diphtheriae. We got this picture here. It is a corn and dipper picture. So picture this scenario. You come home after a long day of studying, maybe at medical school, maybe at dental school, maybe undergraduate, and your loved one has made you this nice dinner. They're always experimenting, they're always trying new foods, and they've made a nice hot corn soup. But remember, it's hot, you gotta make sure to blow it off, and it is signed, My Love. You can see the dipper, it's covered in some green stuff. This corn has an interesting label, it says protein free. There's a little cracker on the table, and the little cornucopia of a soup we have here is a little viral particle, some corn, some interesting little noodles, and it looks like he or she added some alphabet soup noodles. There's a little heart shape floating in there. How nice. So the corn in this is going to remind us that this is Corynebacterium, and Coryne actually refers to the club-like shape, or you can just picture a corn cob. So if you see a long club-looking or corn cob-looking bacterium, keep it differentially in your mind. This could be Corynebacterium Diphtheriae. The dipper or soup ladle is going to remind us that this is diphtheria. So if someone says, I have diphtheria, the first thing you're going to think, oh, I know that's caused by Corynebacterium because I got my friend making these nice corn soup and ladling it with this nice dipper. And it is a species name. So diphtheria is a species name, but it's also the name of the disease. So someone could say, my son has diphtheria because I don't believe in vaccines. And there is, of course, a diphtheria vaccine. It is the Tdap vaccine, which I actually just got updated. 10 years, every 10 years suggested for adults. So you do need to do that one if you haven't recently. And notice there is scum on the dipper. So this visually is a reminder of one of the hallmark features of some diphtheria infections is a pseudomembrane that forms on the posterior wall of the pharynx. Thus, you can also add some more details just logically as to what you might see with this sort of patient. They would have a sore throat, a fever, and swollen lymph nodes trying to fight back that pseudomembrane. And the pseudomembrane is, even though it looks like something you can just tear off, it's not something you would want to remove under any circumstances that I know of. But go ahead and Google that, and if you haven't seen that already, it's kind of interesting. Notice this soup is a little psychedelic. It's a little multicolored. It's a little multichrome. So the bacteria have multichrome granules, which just means it has granules that have sort of multiple colors in them. It's, I guess it'd be part of identifying what bacteria this is. And also part of that is the purple color used on the note, reminding us that this is gram-positive. I use purple for all gram-positive bacteria and pink for gram-negative because the gram-positive hold more color in their external cell wall and therefore are purple. Notice that the content of the note here is saying, blow off the soup. And what that's reminding us of is that this is transmitted by a respiratory droplet. So blow it off, it's hot. They care about you, that's why they wrote the note for you. The protein-free label on the corn can. So this is getting a little bit, I got some details in here, I got some biochemistry in here. This is reminding us that the toxin, which is actually encoded by a phage, you see the phage in the soup, is encoded by the phage is an AB toxin. Notice the noodles. We have AB alphabet noodles. It's an AB toxin, and what if you don't know AB toxins, it's just a little cute way of saying that there's an attaching, or there's an active component and there's a binding component. So the binding component attaches to a surface, allows entry, and the active component has some catalytic effect within that surface or cell. So what I was saying about this toxin is that it works by causing ADP-ribosylation of EF2, which may not be the most important detail, but what it is interesting to know is that this toxin works by interrupting protein synthesis. So the corn is protein free. Again, the AB noodles, just reminding us that it's got an AB toxin. And I explained how that works. Notice the phage in the soup. It's a reminder that there's a bacteriophage. And if you haven't heard of this concept of phage encoding toxins, I'm going to explain it real quick. It's a phage. It infects a bacteria. It brings a coding sequence. And when it infects that genome, the bacteria now is virulent. And usually we say that it's virulent with that toxin. In a lot of cases, pathogens that are highly involved with these toxins aren't virulent if they don't have these bacteriophage-encoded toxins. EF noodles, that was to remind us that is a block of the elongation factor with this toxin. The spills on the table reminds us of a polyneuropathy. Your loved one does the best that they can to get this done right, but that polyneuropathy just makes him or her a little shaky. And so the polyneuropathy can have a whole range of effects. It can especially affect cranial nerves. Another reason to get that Tdap vaccine, of course. And the heart shape is a reminder of, and it's signed with myolove. It's a reminder that diphtheria causes myocarditis, which is an inflammation of the myocardia. Treatment, bacteria is sensitive to antibiotics, but the best measure, of course, would be prophylactic. We talk about the vaccine. There's Tdap, there's DTaP, there's DTP, there's PDT, you could go on and on, because I've seen so many names for this vaccine, it's ridiculous. But it is also called the vaccine with tons of acronym names. So if you don't know which one you need, just tell them that, and they probably know what you're talking about. So 10 years. Let's do a little question real quick, just to assess and apply this silly picture into something more serious. So there's a controversial experiment, and a healthy volunteer is injected with protein A portion identical to that present in a phage-infected C. diff. So what are their symptoms if they've got this A portion injected? What could they be? A portion, oh, that's the active portion. So yeah, there must be a lot of effects. Oh wait, no. Without the A portion, without the B portion, A portion cannot get into the cell, and therefore it cannot be active or catalytic or have any effects. So they are unlikely to have any symptoms such as pseudomembrane, polyneuropathy, or myocarditis, like we discussed. But they are likely to have fun with your study because you're paying them for injecting something that most likely will have no effect. Describe the morphology and grand standing character of C. diff. Okay, we gotta think hard about this. What is the morphology? Oh yeah, oh yeah, it's shaped like a corn or like a club. So okay, it's shaped like a club. Grand staining character of C. diff. Yes, purple note with my Corynebacterium Diphtheria soup. Yes, purple note. Purple was gram positive. Yes, okay, so it is a gram positive, and the morphology is a long, slender, club-like rod. Okay, perfect. We got a lot of facts jumbled into our head. Now, hopefully, they'll be a little more clear with this picture. Feel free to draw one yourself, take a screenshot, take some notes. Um, Regardless, thanks for joining us at Microbiology and have an excellent day.